He's been crisscrossing the region, scaling up the international response, ensuring sufficient beds, testing laboratories, safe burials and education deemed crucial to stopping the outbreak.
This has been an enormous disease outbreak, quite unlike anything that I have seen in my professional life before. And it still is serious. In any other situation, to have 10 or 15 or 20 new cases of Ebola each day in any part of the world would be seen as a serious public health event. But we have to look at it in the context of what was happening, for example, in September last year, when we were seeing 10 times as many new cases a day. And it leads us to believe that we're going in the right direction towards elimination.
Latest World Health Organization figures show the death toll nearing the 8,500 mark, with over 21,000 cases reported to date. And with sufficient treatment facilities and teams in place to deal with the disease, from detection to in many cases burials, the focus is now shifting to the next phase.
Then starts the hard part, which is epidemiological detectives, public health people who scan the countryside, working with local communities to identify people who might have the disease and to bring them into surveillance and then treatment as quickly as possible, and then to follow their contacts. Because once you can actually trace the patterns of transmission and be sure that you know where the new cases are coming from, then you can say to yourself, aha, we're getting this outbreak under control.
Smaller Ebola outbreaks were quickly stamped out in Senegal, Nigeria and Mali as staunch beliefs and traditions hampered the response in countries where the outbreak was most severe.
So the manner of death is hugely important to the well-being of the community in the future. And that's why the style of funeral is given such importance and significance in traditional cultures in this part of West Africa. And the style usually involves careful washing of the body and the mourners actually covering themselves with the fluid that's used to wash the body. If a person dies with Ebola, there's a lot of virus on their body at the time of death. And so if they're being washed and then the mourners are covering themselves with the fluid from the washing, then there's a huge danger of the virus spreading.
He praised the response of the African Union that has some 600 volunteers in the region, while lauding South Africa's quick support and solidarity, particularly in Guinea. Shervin Bryceby's SABC News, New York.
In the wake of the Charlie Hebdo